Apa modal kamu lagi lewat apa yang awal ilo dan kurubin na ko bato kan major leadership ko bato kan poi nado em kajido ko raw em army ri kono no lagi jeni ngani ipen tak dari em ilo dan mo kemungkinan lewat nam dari yaw mana orang army yang banyak kilim kau deh jero awal jero para no all army in Maya. Here, President of Parliament Cabinet member, all member in the area, speaker by speaker of all. And Kagaru Kamali when Manaru Tomajali again roll Tentari. Kill all of the tune of the road from Kamona and Parla. Ijin, Pervenado in the Jipon at the road, you're running. Minister Wase, President Wase, Senator Tony Muller, Parano Kubado with Dr. Alik, Wilfred Alik, Parano Dr. Prostro, and Dr. Underwood, and Kalani Kanero. I'll good similarly, Takadari, Dr. Prostro, a Takadayo, Jarbal, image. Cibang Kecinian Ganian representing CDC, the Centers of Disease Control. Right? Centers of Disease Control. And Dr. Underwood, Dr. Nagaliro Kaliroin, and Dr. Alik, Dr. May Romajan, but Kabelin, Teneman, go through Alvin, Charbali, Kajanek, Kariago, Majalin Tier. Ini makanya wan malu ini talikar unin ada pewenado kia. Pewenado ini cabangan cabaro angan lewat dukun melele wo rogal datang jenis tagaderin kap kemelele detail cabangan dukun cabaro angan kemelele gelap yang kali kalau datang ada kam tahun ini ada kaman we Kajati review bin army MG Koval melele one NPC melele one MOAGS Perwenado ini dengan jika mau carbal boy yang kali karo carbal boy bilo celmai COVID-19 ini kan kamu visa bini ka minister mini jayawan visa bini assistant secretary of secretary parang apa ini bayar lagi ani lihat dengan minister wajib one malam oh ani lihat dengan senator Tony Muller one malam company kecil lupuan melele borong itu
Kumol, Kalani, kau tu juga ada, kamu lelah ni kita cunran, ayo Jouj. Keliaran rain rar koga, ministerin, tak ada rain matar, ya urjan, kerja kerja tu jangan dengan, ya urjan tu perlu island ni. Kami arom interview anjur ni air wigala, ijo lagi pelanjang kerja ciri kuku, im kata peran rain ini kira. Pengen juga nono jadi kipen ke, jen tu pokoknya ugut jadian nan ke air, kabila ke air, fraud, pejo jen cumur melele pendon. Hari ini mau ada kamulul, oleh berain ring pokoknya air, ministeran air, stafian air, brother real, agensi lainin, pejen junub programin. Kaji dari melele ho menodan senator Kalani ba, jen kacung kebawu pengalin meder bolor yang dia, calm down ni orang, cabaru kacung tu komita rong jen berkonon kaki dia, perlu mereka cebulun melele, akhir kirim cabalele perlu, cilen karlir dia, wenamman nanor, menino dah. Ibu jangan jenuh program ini, tolong, brother, kumon.
Ini lihat minister wajib on mau.
Mono Kalani. Pagkano yun ngai kuba yun kami roilo college. Kuba yun naman na kile. Rutor rarilo kamu nilang mani dito yan. Ala ka rutor rarilo na yun. Ano yung program yun ito mananahan. Giptebi. Nanti yun kami lang ang mga araw tambah spreading ng coronavirus. Lalu cenderung beliau hilang tak, vaccinate, and get treated. Mula apa?
Mall Minister. Iluturin ito talaga ba pwede na ito? Manarang karena yung melele ko order itu tak ada rin berarti jemaah. Capai jen kaji ni road, ada ngan pwede na ito. Kami roh jari yang berjalan ren melele tarin yayo charteri yain jeberi kier elemen arwan mal bagi cimpen ilo kata baru kan kaji baru Ejmeu kameu ranar, eno tu iriu antar dari ini. Ini persoalan dengan cara dari modal ni langai kecil, angai calo ini kita antar dari berpala. Ya peri, ya ini peri itu, yang ini cara pelabuhan tak dari mencegah hari, kemudian tak kata baru, me save life tu. Wawin me rakat yang berjejak ikijen jarwalin tarinai COVID-19. Ngani kalau teman cara dengan minister ini cara orang yang bersifat wawin buat.
Nomor pemual Kalani berjualan clear. Muktajan kerita untuk kijing dengan dari jentengin anak ilang rin, kan? Kaya kil bodor kuare, kili kan kaya yang cepet orang untuk kijing. Ilo terin yang jangan dia orang untuk kijing kia. Imi jo je kuj kamar beri, jangan kia mau. Wanjong eorcet, rejapunan kan. Wawinan cet Real chen legen inam kacungan mukomir. Aga enodan an Dr. Underwood kerbawi jolake ilmu neman melelewan. Yawan kalang cuano je uwokan ngan kajin ni nara ka. Eba ilo tereng me kiji ne beri jin ke aur lak be health resource waram. Romer cerbalek pedalon ke cerbalek wo je. Aur lang der fokus ngan kamar beri kejene me beri jen kier. Cenair kasus dari dulu jaga me red quarantine lo jon wawan ke jiba kokore resource in me aur dair beri jo me tika jo kameuran. Dr. Underwood, your interview last week was, like I said, you hit the nail right on the head. Can you elaborate a little bit more? Because there are some concerns in the community that people are flying in and then they're self-quarantined for 5 days at their homes. Can you repeat that? And we'll try and convey that in the native tongue.
Okay, thank you. So, good morning to all. At this stage in the pandemic, we're at day 12. There's been more than 9,000 cases diagnosed. The number of cases for the Marshall Islands per rates are high globally. And the reason why we're able to say we have high rates is because we're testing a lot of people. We're testing a huge number of our population. But more importantly, we link in testing to treatment and vaccination and so forth. Now, to answer your question specifically, at this point in time, the risk of contracting COVID-19, if you're in the Marshall Islands, is extremely high, okay? The risk for someone coming in from another country is more in-country here. So we don't really face an existential risk right now, it's an internal risk. Also, institutional quarantine, requires a lot of resources. Health resources we don't currently have at this time while we are faced with the situation. And more importantly, it doesn't make any sense. What makes sense now is if you are coming into the country, we can have some requirements that you need to have, like being vaccinated. That is to decrease your chance of dying and also, decrease burden to the health services when you come. Right now, to travel on United Airlines, okay.
Sorry, Dr. Underwood,
Oh.
not to cut you off, but just for translate,
Right.
trying to translate. And orang Dr. Underwood, takalewan yang menjalani infectious disease, out to the melele ko ngani kacang translate caman orang merong itu tadi jalan hewan, emang melele wan. Jauh kau beringe panci dengan cegi-cegi, pada kalau kan dia dan jauh dengan hijau dengan awal tahu. Para nanti melele kan kayak kan Senator Tony Muller, ikijen, itu tadi RMI Covid-19 recording mo it. Melelewan Dr. Underwood karena perverion emejep opinion meningin a perverion science. Ilo cigi-cigi nanta kada rin cara boleh melale ya yo ko wata dalo. Yo cigi-cigi yo mantara pain calap chorre elabal. Ade ilo virtual wa win rai bijada rai mengo me rai buk cigi. Ekonomi kan ilingin radam yon 1,000 case in COVID-19 positive. Year lui ilo majali. Kejigin radam yon 1,000 ejuan radio agai bay cuman ko me ilun la ilo lalin. Matan ko ilang tara. Ikijen COVID-19. Ngajari kiri nambagi na ipen population ni in kiri pen lalo ilingin. Kalau lalu orang lalu jadi ingin macam ni. Macam radio mereka orang bukan nak radio, kerana radio company cerbalin teh juga, yang mana company teh juga, RMI cari orang menjikan teh juga, recap teh juga, RMI berteri teh juga, rather than 1,000 plus. Ilo anke melele, unin air kar kadalau RMI roar ini dengan ran quarantine bogumir. Karena kaya ni kiri nambagin ilong majalin cuman anudai jaga juga high rate in aje COVID-19. Ele jen cuman me RMI rori real untuk lo majalin rani pokok COVID-19 dengan majalin. Melele merong kar ugo de ilo teri terang.
Yeah, I was just gonna carry on to say we can control prerequisites, vaccination before arrival. And you really can't control many other factors. We encourage people to wear masks on the plane. To travel on United, you no longer need to be tested. So a lot of travelers may be also carrying infections. But once you get here, we do testing on arrival at the airport. So far, for those that arrived on the Fiji surge flight, other United flights for people coming to assist medical referral patients and other skilled workers, we haven't tested anyone positive on arrival. But we encourage people then to go home and do home quarantine or home isolation. There are general community measures in place as well. You need to wear a mask whenever you venture outside, or if you're in a public space, internally or externally. You need to wash your hands and practice good hand hygiene. You need to avoid gatherings and crowds as much as possible, We're asking people to be socially responsible at this time. So anyone coming in, we ask them to do that home quarantine. The chances are at this time that they will get infected from the community rather than they putting the community at rest. So we ask that they follow our community measures once they arrive.
Dr. Underwood ay work kami meno yaur RMI rai kamane mo ilo air real mo to lo majalin ken kayuan rai vaccine ta rai po wa ko ken karo ilo air travel to ag ilo palon ko rai kana match ko air pralat tabarilo majoro aku ajalin ngeri real to lo majalin pretejir chen ka rajino te RMI rai tinchinon anak kaman cegin self quarantine lo mo again what positive case ilo ay rilang to menewa iba kemel lagi RMI rin ka ba ngana ole ba RMI aur pagkajoy kanak me juar chen yen nganien chen kacem chap ko wal ilo yogo me elugun bol RMI trip ko ba ya egro da pujin RMI ro ko chen quality chen yen ngan yen karena match gi nara mene wi le ngada na awar bata chai wi wai vaccine pog wai ko me ako wain ko be me kono no ga mene gi chen gi ko me recommendation chep chen ta ga ring mot aga an all bro ta ga ro kap chai di ro me ro ka ta ken nangan mi
orang ke common with observation. I'm not gonna ask a question, I'm just gonna state my observation based on Senator Tony's question. But in Marshallese, I'm trying to state my observation to the Marshallese community here in Nigeria. We look at our meneo Senator Tony is my ikijen. Child ikijen self quarantine in the moment. Ilo an reservaran at bit. Kajong focus ilo chicken kamarmaru. Chicken test go, chicken treatment go, and chicken oil. And with our many in all of them resources again. And health services, staff, doctor, nurse, clean color, all of Ragujilongan, Chagan Bitan. Iloan, Takadora, Charaba, Iloan, Real of the Varage. Rolag Real Auto, Emerald Tazier, it's negative. You were really long and chicken quarantine, got self quarantine, Lomomir. Where Takada ram, no ram, reservoir ram, I did ran continue labot. When I come on each other, guy, in 4 kilo treatment, kilo test, and kilo oil. And our real and many. I will, I know, Dr. Underwood or Wase. Elegant and spread, and while of outbreak, you look community. Elegant and while of community transmission. Elugun chala gunin pe jenjap kadala bodor pe spread lawa elam long impact na yan jan RMI joro yidok and carry nagan mitongan lawa menin jijay wichi mor belala pe jenjap mijak and bagay real lang din RMI man na ek kamani spread come on
ngay baca teman tagdo prostrom ngelang cekjupo kajidagi kanonogan echa perbero dion kajidagawan Senator Tony Muller ikijen rilong ini lihat apa cekjugum kap wawin wori kamani jogo jet kap recommendation yawan CBC baik kejujen melele tagi di kamani jin tabori kamani ligin ngenari lukun melele ngeni rilong ngeni bat cagar teman Dr. Alik, but Dr. Prostrom, the question was, I will leave it to Senator Tony to ask it. Kaji dengan orang kaji dengan Dr. Prostrom, pada mana kami lagi. Ijak kaji dengan kaji dengan Dr. Underwood. Ini juga dengan air company ini, taruh dengan presiden CBC.
opening the border. Next of quarantine.
The people coming in, pre-COVID, we closed the borders because to keep the virus out. Today, the virus is here. Can you elaborate on the protocol of self-quarantining and that sort of thing? Because last week, Dr. Underwood indicated, some very strong and very good statements regarding saving on resources and what have you, to focus on where they need to be as opposed to just what we were doing routinely pre-COVID. And by the way, Dr. B, welcome to the Marshalls.
Thank you, Senator. And thank you for the island-wide welcome that the CDC team has received. We sure appreciate the invitation of the government, as well as the support from the embassy and from CDC. It's an honor to be here, to witness this amazing response that is going on. Clearly, RMI is turning and facing this COVID outbreak fiercely, not to be victims to it, but to fight with vaccine, to fight with treatment and the testing that's going on. So I think you're in the middle of it still, so it's difficult probably to see how well you're doing, but it is certainly unprecedented, even among the other Pacific Island nations, what's happening here. In terms of the quarantine, of course, a very sovereign internal decision that's made here, and CDC doesn't provide formal guidance on the steps you've taken. Clearly, the decision to lock down was a surprise, I think, to many people in the mainland. But back in the Delta days, there was no vaccine, there was no treatment, and we can be quite sure it saved many lives here in the Marshall Islands at great cost to your families, to your economy. But then we have Omicron and BA.5. And it is very hard to keep BA.5 out.
Okay. Dr. Brostrom, Takada Agency Dizim, Kajung Wale, Kajirigin Yaman, and Senator Muller. Kamorol can Kurio and Baron Kuwado in Chibiang, Ilo Charbalagin. Emej Barkali Karale, Iloan, Redo Ridagam, Lali Charbalagin, Red Book Chikia, Jenagar, Todo, Ilum Tabarado, Majalin, Lupun Number. Chicken and Charbalagin put Chigirum respond and Nang and me, Abilo chicken tay go Babilo, Charbal just met other in recommend. Ken Garo, can an hour why a vaccine. Eva Chikijugo, Ilangada, and Tarinagi, Nang and me, why. CDC a Jabledo. Chikijo ko mandate ko kakabili ko may ngan kill border ngan kabawa border mo mo ko jet barkano kan kilo teryo may COVID-19 at chinoy benangan miyor arbar wa delta aga variant me delta ilo teryo ko echalo kar vaccine even karterin tarinai RMI rolo America rar ilbu kenan gar kilo poder ilo terreo ilo kia me elang vaccine and PA5 ago variant me kia me terilo me jeroin majli kejuji tarinai and ibar kaki me mi ke aur kojen why Jangan yang ibarat karena ngayon kau kuba apa jen rinjet, aku orang kau kuba apa itu.
Can I add to what you have explained?
Of course, sir.
Especially for us to translate to the people. You know, yesterday in your briefing, you emphasized the importance of cooperation of the community. Our leaders, government leaders, our traditional leaders, our local government leaders, our allies. Can you elaborate more on it to tell us how that is important in order to help our health services team in the combat against the spread? I consider it been Dr. B. Along a baron Kalikar Auragawan cooperation Aroji community. Ilo Aroj Lakamani response was Arojan spreading it. All of it volunteer. As you know, leadership, Jan Eurojaranan, Jan local government, Jan Alabranan. Our gan many know our gawan but in slow down in spread the land. Please, Doctor.
Thank you. So, we were surprised that you were able to hold off the virus this long. From a distance, very, very few countries were able to maintain a quarantine like you did through February, through March, through April, through May and June. Amazing. We expected a breakthrough and it never came. Then finally, I think BA5 did to the marshals what it has done to everyone else. So at that point, it is time to turn the page. And that is what the Marshallese government and community and ministry was able to do very quickly. And that was equally remarkable to see the response that has occurred. And from the federal government's perspective, our job was to get you what you needed: ventilators, additional vaccine, tests, and therapeutics. But of course, those are items that sit in boxes in warehouses until you have the community and the people and a good plan and good leadership to begin to move out. And that has been the most impressive part of the response, that the test and treat centers were put up early. The community accessed the care. They trusted the plans from across the government. The message was consistent, and you were able to step in early when most countries were unable to respond nearly as quickly as you have. That has resulted in testing numbers that have never been seen, testing positive numbers that have never been seen anywhere in the world. But that is not a measure of virus spread, because the virus is going to spread here like it spread everywhere else in the Pacific and around the world. It is a measure of a country, a ministry, a government, including the informal leadership and the formal leadership that was ready when it came together and was able to provide the resources, the space, and the volunteers and people to address the needs of the community right away. So people could come in, they could be tested, and they could be treated. Folks came to the test and treat centers here with an expectation that they were not just going to be tested, but they also wanted treatment. That is a major accomplishment by the Marshall's government. And so I think when this begins to slow down, and we expect that in the next few days, it will be time to turn the page again. But for now, I think much credit goes to all the agencies that came together, volunteers, the test and treat centers, which have been just phenomenal so far, and of course to the ability to work together in very difficult times. We see these nurses and these doctors are really tired. They have been they've been preparing for this for 2 years, but now that it's here, they are responding to the call and serving the people the way we have not seen anywhere else.
Okay. Then ilo melele kan tak ke prostro me kali kalau ke ebayan air gar ilbu menin air ilbu kampulang do jangan tu nan gar majelin narong gar rebiji ben jabri on the COVID-19 rejim ebayar ilbu be jangan jet lo lalin cijo tu gar rio jengai agaling jengar rio na me agar cino wal nangan bijin radri lo lamboy aga wan garto andri lo gi aga mi andri lo PA5 e jaba ien baru go dalok page na eri lo ko charbat ien baru hitungan return the page hitungan batuan page charbalin respane o cengar ali karga community spread aga nangan bijin ya jere lo kam chujugun perbo lo majelin kalau ke charbalin response yo elwan emman jito ko mloy elwan emman charbal go em cicit am takada gabne jerin charbalin response go yang ndangan bi charbalewan federal government agar kijaran amerika cibang kar ke dikit ilo el to pendalader vaccine aga pendalader ke menono vaccine uno kana meji wayane meji page kap kinte kap meno je ngan ke do ji dengan cigi ajar pada orang nabare ki ya men pag cigin ejilo cigen tay kana ilo menjugul kana kap coba me men an cigin ay meuro ke jana lagi ngan tay e jwa elaman man pokret tay emlamat tridio wajab tay je melamat paji de memrol ar tay em kalau cigi am tri agar jelaw uno mencegi joko melele ko cetra beri bentang dari menawa jelo ke elu naur cewi cedi dengan ini cewi kaya dari melele ko me regime consistent cabu utak can melele no cen cakaron rata cakaron level dah hilo wi bahan government kap prago jet and private NGO ko kap cigi ko jet cigi jarwal ko jet aga jen kanonogan melele me it consistent ilo cigin tay jagane jaba lalin elabay rilbuk pa majalin nampain army ngaji kambiar republic jena nampain army ilo majalin elaban wat melele army ribu tangan cigin tay ko tay rajin dengan lolo cabro cingin ini lolo lagi jangan nambangin, an ya jadi kalau jadi coba ini lolo pai nambangin lolo cem meleli ini pun lagu tam lagu nang ini kali karena ibu army jadi jalan teh, emene yang main, ibu army boleh nambangin berapa orang, emet kali karena ibu army jadi jalan teh, bar leng army jawab leng kalau ini kita jangan rorik pa jadi, cek juga jadi rilau lawani, cem menil kalau lama kit menin, ay kalau ke Jouj, ay kaya nurginan ka army ro, coba peritulir jenian macam. Tapi pernah kalau ke ilowi kan itu, red takderin red kata menegi ini walau nambahin positive case. Emlo terus ini berjuang ini dengan turn the page, ya dengan berjuang page. Ay kamu takderin, naya yang berjar baru rejput konair ilo chicken tay chicken ini elku ngelabar kadir emi dilo air muk parjuan alen dilo tam leadership an major meron konselo kami kobai bendron kamolol kobalo ilo clean an tak prosper yang kamolol takada ne kabale proret pokonair.
One final comment then, because I'm afraid I did not even answer your question about quarantine. And that is, as you mentioned, the risk from other travelers to come in, even if they have COVID now, is not going to change what's happening already in the marshals. I think there's good effort to protect the neighbor islands that are still COVID-free. But from the epidemiology perspective, there's little benefit to having significant quarantine continue. Again, a very sovereign decision, but from the outsider's perspective, I think it will not affect the number of cases you have or the impact of COVID in the islands from continuing a strict quarantine. It's been heroic, but I think maybe that page can be turned soon.
Tangta prostrobe kajang waga kajiruan senator molor ikijen RMI Rover riang malalagon ngar kuwari. Akai kadi karge ko da ga risk yo ilongan RMI riang to kolong majuli. Jab perilo strict quarantine me 4 minute ga human rui quarantine chongole men ran ko evaluate jongoran. Cek-cekin eban celete kalau eban infecte eban impact eban lab impact iloan army real to eban kalau nangan mi iloan majalin eban katana apa eban luang lah
uguti. Eban kaman ugutak. Iloan army real to
eban kaman ugutak. Kali karge ya cek-cekin yan kienin magi yang untuk cawan ni yang kamane air kaya ilo wawin go mero ilo aga ilo an yang takdoro aga epidemiologi jero mero alin namba yang rimal yang kajian kaman perjanjian yang tawar ni pekcigir yang berbuat kolej itu dah berpalo antara dari an army jadi orang tu kalau majlis, ejab, eban kaman utak, kalau nangan misi, anak aja. Thank you, Dr. Brostrom. Ngani beliau tu kan Dr. Alik, ben wan mang lah bodoh, bisa kau ni, Dr. Alik cuma ada yang Dr. Major, ya tuan practice itu awal tapi jauh je. Arto cuan volunteer cibang ilu ini me ela baik takadoro yang pro ragabe elok kabel ikijen aja murid parkirane kamolol takadoro alik iluan kuwa atau bidan letuk cibang kina nanti cuma mau mau elang kalayan
Kemudian MC Modena bajiriga nanin janaba kle Senator Ranjini Minister Kemudian juga John Ranome Aman kau John forum me ila liun awak pekerjaan liun kenana kena janaba kenangan ini me yang jangan cerita all ben lalin yang kia perlu majalin. To me, it's just a matter of time they got here. Yang jangan meaning that all ben lalin. It's a pandemic. Yang boleh na orang punya luar melele nangan begini, ini kan cenaba, ini orang belen eligimen, agak ini kan melele menin tain virus. Pokoknya ini melele tain virus, ini birurar, itu kan kerana face mask, itu ketolak orang, itu kan ini. Jadi melele menin to me is, if you understand the why, the how is easy. Okay, that's the basic. Wajah melele nangan begini, wajah ini birurar menin kemana? Yang urjirga cenaba tale. Maromba experience kan game jaya lo nangan mijin, eno jono me, iyo ne nangan mijin lo iyo cerpali, ibo royal lawyer, royal nangan mijin COVID. Iyo kan aja experience jaya, eno jono takda. Iyo cenaba meni na coronavirus, virus itu pun cuman kecil, ini pun kan virus lalin. zillions. Flu virus, begin kind virus. Okay. Many coronavirus, chen mga pen merong nur. Ya we only ben jon chen ba living being. Jon nga jeb armit nga jeb many nur ben merong nur. Ngani belo ayi ben nur. Ngani belo te ban nei pon jiru rani jabu. Ya we only jon ni ben jon armit ben merong replicate ben merong kaman nijin. Yang kaman ben ajerir. Yang muja chen ba iluar kangana face mask. Si paparan menin renolo en bin armich. Kana virus ya renolo ligum najem nem. Kelan renolo en bin melo podum ngajam long. Una lu out of face mask. Pen jeb relang watch. Ngajam relang watch emuch. Gia kaman gia nejinim kamanan replicates. Ini mah kin karo virus coronavirus Egypt cimarong Egyptan cijino ne udalok una hora rebel social distancing cijino ne katoloron kana ge eban koan ibudalo ji okay ko manda kalale me jibu ko katoloron luguna hora beban tabaru ken gajilu jauh juga kolbir kan ke kalau virus itu man jangan ngawat virus ini coronavirus ini cipu jonjin itu jangan arahnya cipu jan ramai nampak ini lu nawar punya kolbir roll seconds at least roll seconds kan cukup ini my Ngajalo jo me kolgan hand sanitizers. Meningin. Wanage meningin jiru meningin reba non-pharmaceutical treatments. Non-pharmaceutical meningin ko jo muno. Kamani meningin. Ene kapajara virus. Em gia jeluguna janaba gia elang treatment gia. Karmoda Arjun virus element alpha, delta, omicron. You know what? Chalokar many reba vaccine. Ilo terego. Emilang army rajaw. Ilang matarang lugar Arkansas. Jalo. Ida only week Mitch Armich. Ilo terego. Ganagay raj. Chalokar vaccine. Jalo no. Meaning vaccine. Vaccine many Egyptian menu megal. Our vaccine jen jaman. Our vaccine in pneumonia, or vaccine flu, or vaccine polio, and that. When I joke polio lalin, and vaccine. It's John cancer by megal. In vaccine, John and tool one, Janma, Kumi Takadara, and Paparai Nangan which. In vaccine again, Paparai. One buggy and Imako Nangan which, a Pancharbal. Why Puggy more than. Ini pajirikan mini vaccine kenapa one jok kami flu vaccine jangan kalian kaman vaccine jaman flu vaccine rate kalau flu virus im kenapa kaman rogi mi boy go kagai melele or jirik matan flu ipam riboy koi kung kamera nangal jen flu karena itu jirik parts of the flu. Vaccine is a new technology. This is like it's like going to the moon. Okay, John menu luguna jangan lugun couple lang. Kaya vaccine mRNA vaccine. Tayo mRNA vaccine. Messenger vaccine melele wajib matan kiji flu wajib matan bug information. Okay, in common virus on it. It's not the part of it's not a part of the virus. Bug information in common vaccine. Why go gaga? In the many antibodies against the virus. melele woman nangan mich chen coronavirus kana ko chep gai then woman ko chep many relevant information make it innam kiyo kolak ione kijene elang yan sa paris ombalin rumajala yan sa paris ya pa ale talat tare nai jemelukun yan bennem paran pojagin royone kijene ko bajak yamnya kamolege kolage meni vaccine elugun jarbal echalo kajid when lale ole ben elang real data kiyo kenan real data jangan ole lalin ni Amerika kay vaccine works it's terrible ole ole ben gumi ame ra chokojen coronavirus either ole raja vaccine komaron bug infection then jorang war bug vaccine le komaron bug especially with the kiye omicron you got alpha delta many omicron kiye chelamai kiye elugun kabego ajam lukun lethal ajam lukun kawada okay janaba kola bug vaccine mol komaron bug infection je lugiyo lalu arang ibu relun RMI vaccine infected aku je loge kiye rajab nangam ya lawa tang commander severe disease im I bill mitch lukun cerbalan vaccine that's what it does ngan paparai severe disease I dukun trolol nangan mi relong bill mitch that's cerbalan vaccine komarong bak kijene echol kajid or vaccine komarong bak one lale idan ucara rapane dalam ku Jilo laj bido lagi ngayar tal ngana ngaj pelo covid ward elo ya jam cerba la ji bang lamar elo aj bido lagi chelok covid-19 jan kumi galo anaj bido lagi ya ban jadi rong le mene ra perejen moda jan covid-19 ra bagian exposure jeb kan covid-19 cuman menu yo naman okay kana ge cerbal vaccine tamaga iba kana aramin majar pelen maro 80% rar vaccine mo ta ga elo kiji raba jagare yarwale awaim jagai lo tarego karjul percent army rar vaccine chinu 1% elo war chawo kana ge itibul kun lab vaccine do tareo elo dongan jegin kajam pe oja pe eleng ya bel chelo jinne ibaru jelo ya 80% vaccinated ilang kecil nak bumi orang tetap guna ngamci. Kerana ano apa? Awar vaksin ilang rutarena yang cepat jangan benim. Kalau yang nangan macam ni, kau orang berkecil aku jauh. Yang kau nangan macam. Emilu na orang pejan ni jalur kecil tu apa? Wan bervak. Ayar berkala memang ni. Emen vaksin. Ajan ber coronavirus. Ayo renangan macam jauh lebih. Ejep kena ya jumur agai kita makan vaksin kan. Yang menjadi guna kajung, meja jum je bah. Kami yang bervaksin ni, bayi cerbal, cerbal kaji tegak. Mulai vaksin ni orang side effects, cerbal kaji tegak. Orang ni lah kiri kerja bah, risk versus benefits. Orang ni kemana apa yang benefits outweigh the risk. Orang bervaksin ni. Kau ni metak belen pem, metak param jiri, metak any benim. All of vaccine recommend kan. Nana is given. Itu melu wanangan which. Aga benefit ana ye yang am. Jangan bay any benim macam ye pewacangan na, wana ione kijene. Kalau ione ye, ye recommend nangan which. Kalau tak kajang, kalau ilo awal yang jual nama task force. Ngajun lah RMI Ameng task force. Yang mereka kacung, nak all we kami guna gua lok. Cinuan kan wala wat vaccine. Yang kacung kena ni ben army rarang. Kami lagi tak, rayu juga kena face mask. Taken. Kalau tu vaccine kami guna pushy. All over vaccine. Kami lagi tanggunin ber vaccine. Yang macam kalau kaya.
Jauh, berapa jauh tanggal? Ngan likun pa RMI road likun melele or ke why ni ngai kira kilo bodar jen possible kata nang ni jabar pa ini bagi real mo pa
Okay, ngai tamaga enagar itu. Community spreads like enagar itu. Karena gay, teja gay, then 100%. Teja gay, jalo jom teja 100%. Kemarin teja negeri gay, agak orang jadi work jipong. RMI kori longan namut, jalo teja 100%. Yang tamaga enagar kualawat. Yang kerja perlu medication phase now. It's not prevention now. Medication now. We gotta medicate this thing. Contain it. How do we do that? Vaccinate and therapeutics. Key, menyan berigi. Menyan berigin, koman gigi, menyan relong. Yana many one kabebo. Kajan belan mi dengan Senator Muller Jerman Pajib. Ini kajan orang key, all barang game. Okay. Ini one kabebo. So we're in the takde yun ba? Tepel lugu American imjan mo yan imjan berjin. So what should we do about the? He's here. Okay. Yo kalama kalama lo jen ay na yun takde. Juan vaccine. Jangan tool yung vaccine. Nabaro meron iba therapeutics. Ilang uno ngan ilang uno ngan poparay nangan miji. Jono uno riba Paxlovid. Uno may giga Paxlovid. Iber giga. Iberang. Yung una ja uno ngan charbal koi bagay within 5 days. Ben charbal. Kawan katarangan rogi ni cari tu bahaya lang kawan. Ya ben charbal. Rana kami lain mukota with symptom with dok. June week ya ben charbal. Heli charbal it wouldn't work. May gumiga John by health services, Dr. Underwood and his guys. They have John had many test and treat. Itu gumiga, they test them out. Ngapai pagi tu, recommend you gilo kalau cakap. Radalem, tak apa, gila le SS, ragu juno. Ya, uno cara kaya ni me ruguna cara risk high risk. Lemoli lengalok, elangam tanggal lenga my plot elangam menu pro meningin. Kumigo me ragu pengunui. Kaya ni me cori me jalan na, kena jalan karapan dungun coran. Agak koi pakai muka tanya orang luaran, your symptoms. Ibu jaman mana mereka mana? Redom, war pajib, raja ke, okay. One negative, orang tangan juam pakai vaksin. So there's therapeutics going at the same time at the the tents. Kau pengunui, orang ambil, wajah pengunui, orang what vaccine, orang tangan jiran pakai vaksin. What vaccine? Terbaik. Dalam rak taklon ini yang mana kan? Yang macam ni juga, yang mana mereka mana? Baik, yar perlu ini yang lojo ni perlu rairak minat tenajan. Kami orang itu kan screen ni aja mengumur. Ratejir, screen year. Raga mana tale outreach. Cuma, lu guna mana? Kalau pagi tu jadi caraku, biar tu melana ramai orang treatment. Jadi anu kami 50% aja bagus. Young people, they healthy. It's like they're vaccinated. Hey, kita berak tangan pemur. Jadi anu kami ruto over 65, elangar tangal, kayak ni, ya, sebab lewat. Wajib kau cino rak. Lalu bunuh, lu cakap, yang kamar, yang berapa? Kaya naman rad test negative, cepat tangan jual untuk vaksin yan. Karena kaya, yalah walin tak kalau kaya, jangan apa, walau lama kaya kalau yalah walin kalau kebarang ada, walin ok, ano, kaya. Lujan wawan kalau kaya kubi gambar je nangan mich. Everyone survive. That's an immunity, natural immunity against the virus. Okay. Perjuangan wawan bar an mij virus. I am all of vaccine gonna with Bagilo Yanima with Jimnanganimichi. Okay? That's the only reason. And the main purpose of the vaccine is to prevent severe disease, hospitalization, and deaths. That's when I infected, and you look you, but you know, and then all of them, you then go vaccine. Emilun, Jay Lun, Roll, Eja. Can I roll it? Tell packs of it. Karak remove. Kaiba. More than yellow. Covid ward, they are very. Chalo. Gubing a right virgin, gubing or are relon the moda.
Kadang jod kaji kalau lale eu cuman severe lah, eu cuman awat ciri-ciri ni RMI macam ni tinggi dia, celamai, rain, ikijen COVID-19. Compare dengan terlalu ikijen COVID-19 2020, kalau tahu yang rumah tu, eu cuman pewajakan eu cuman kau ada rumah ni. Iya, eu lo experience yang lo angkat carbali lo ajbedal lo years.
Inge, emang kaji tu nama senator. Jangan makan lagi karena moda Delta. Delta alikun menawa alikun ecap transmissible dah alikun lethal. Kawada dah alikun kawada. Jama alikun kabebo kawada. Ibu orang macam menawa Delta. Lalu cargolo armajolo Arkansas Delta. Ailo terus ya berjaga Cina untuk vaksin. Ya Cina walang tak. Here we're dealing with Omicron. Omicron is about cuma malah jatuhin Delta kan. Loke ilo majali jalan lain Omicron mana BA.5 Omicron. Mana ke? Ilukun kabebu aja ilukun kawada lethal. Agar ilang regiment ni, agar wana ibe vaksin kan? Orang jiru tam simptom aku pun. Ilukun meja jo ni, pag vaksin kan apa regiment gue, okay? Ilang lagi ilo majal, ibol case. Imtita ko, ngaminga, majlali, rates of hospitalizations and deaths. Infection is like, yeah, 2 minutes, yeah, we'll get infected. Chalo kaji, karena ini ilun transmissible, contagious, ilun. Chalo kaji, all around. Next question is, okay, you get the infection, so what's going to happen? Rome Raja vaccine, you know, agar tak de Underwood ba, even 80% lumajalin, Raja vaccinated, 80%. That's a message, man. Rorar Mitch, ikijen coronavirus, 80% Raja vaccine. Okay.
Rally tunggu perjalanan RMI rorar jauh kia, merah pazil, dan jen rat pazil dengan COVID, bilang macam ni, merah jauh, elang air raja puai.
Ingat ni, Raja puai, ini ini. Jadi rorar Mitch ke ruruto ke. I mean, the high risk anyway. Ramarangan mention any kind of infection, flu. Ramarangan kami jer. The bottom line is like, kumi orang you know, largo Jonah Army 20-some years old, are vaccinated. Kerja juga Rome kata, are vaccinated. And why? It works. Mulai ilang side effects. All the vaccine is side effects. Jauh kaji. Meta pain, meta param is part of it. I go your way. Ini mungkin karoi. Ilang remember about therapeutics. Ilang uno kia. And what you have ever heard of bill kia? About death on arrival. Rado go remich. Karena itu agak ter. Karena rumah tongan bill ER jagai. Ilang uno. Many packs of it. Jono uno. I want a boy. In Murjani. You got to do it within 5 days. And we want to measure, yeah, but look, conference, you want to only been Secretary of Health, Dr. Underwood. Want to just bang on RMI, hey, kailangan symptom, jepper, call a emergency, whatever, ambulance, take you over. Kalau tak mau ikat jinik. Ojo ikat jinik ojo lagi menyam coran.
Matan ko army ranger.
Iya.
Ewi Caesarean ngayon jam symptom. Yayo poin yo kain kayo rin lang gani. Poin yo kain kayo kaji. Ngan test ngan get treated and so on and so forth. Raini ni work to Caesarean ngan. Pagkaro mo test, men symptom ka na rabarito. Awa ka nga natin ko chino niya.
Inge, cuma cuman kami ilo tiada lagi reba test and treat. Belakang waktu kan rada je gue, one positive, iya, rada le kau mereka penguno, ilo penguno gue kan me Paxlovid, gue bagai, jangan peel for 5 days. Ekarang risk factor. Kaya ni young guys, jebelok. Kaya ni ruto may lang risk factors, tanggal le mai pula tu mungkin. Beguno eh.
Alam ngayon jam kan vaccinated, menakan routine ako. Itu jam booster kan ro. Orang symptom yung kau kajap kano yung kawalan ako yung jam mo ito da.
Okay, eman kaji tu nai. Elang, jangan ba, rar po kalau 4 shots. Akan ke ruto ko, si 7 years old. Tanggal, meringin. Orang pag shot ka na olip, aga. Their immune system cannot do it. It's not strong enough compared to someone who's like 35 years old. The original protection ni pair, rabak kijenai, rabarong coran. Kiyo rawi raguno.
Meno yakin ka jiwan menakan ilakan ruan ni orang vaccinated, fully vaccinated. John at 69.
Yes.
John at 40. Error chimor pag symptom ka. So RMI में 4 year एमरों तेज़ होतम self quarantine. RMI में 69 एज है कुछ यम्मा दोनों के थ्रू.
Yaman, hengai. You're right. Junior criteria ngan dalam Paxlovid, kau lemua amigo. Him plus chronic conditions. RMI 69, kau dah many munui. Kenapa? Corang har vaksin ini barang, kena ye anu ba. Kalau ruto lokai, yang macam immune system nam. Corang parpa syal kan ai.
Nalar beli bayi. RMI में जैसे 69 एज है कुछ मगर जब कत्तर है ना तान्या. जब कत्तर को के थ्रू.
Jab katar. Kalau tak kau, menu je loi. The key symptom. Wana ikijen. Whether that kuiyo, kau jalan ke, macam ni belo, yarum. Kau just run to the hospital. Corang kemarin seperti stage ni, kau jenuh, kau keluar, jenuh baik. Lemulia lengalok. Test positive, kajian ana misery. Yang jenuh leng symptom macam, yalah. Medical advice, kau bangun ni, me Paxlovid. Pen percibang ber vaksin kau apa? Kau cara kami roll ya, cingurari, they'll do fine. In fact, 80% of kumingan mereka, they don't get the severe disease. It's the other 20% kumingan mereka kuin rutong mereka contagion dengan. The bottom line is like get the vaccines. Number ilang uno. This is a new stuff. Uno ni kaya jika betul kan mereka last year. Last few months. Okay.
So all of you are vaccinated. Vaccinated ka booster on. May kagala pagi, empok symptom kaya, nakajilin man pinit, but that's all.
Yeah. Exactly. So many of them transmissible. Transmissible. Ibu cuman bagalo man, all of raj bagay. Guarantee. Okay.
Cara robot telu rumah.
Coron. Robo ke. Nini, coron iba. Wajah tu adalah ketan biaya juga kau marung pakai.
Abang manajer pangan army tu, mereka tadi ngebut kabe. Awalnya mereka tu fast itu. Ada colo kan rolo.
Okay. Kau colo rolo ke? Yaman. Aku kalau ni lemula riu, lengolok. Ibu orang chronic conditions. Tanggal, ayah pola merengin. Ramarong belum pengunui. Pengen luin parti bangir. Kerana the good thing about this virus, kids, man, racap dukun rolo kage.
Yang puru.
Yeah. Thank God, the kids on kamu lah ibe, ajari racap lukun coran jenangan uji. This is of all people. Coronavirus, this is of all people with chronic conditions. Okay? Kumi orang macam gini, jenama ratangal, eye pelat, lemoli lengok. Even younger people with these conditions, they can die from this. We saw a guy, I built Ronjamani, Armich. So, iba kamu lo ajari, they don't really do that. Jenama the ralabuk they do okay. Pada jual gini, elang vaksin kan lalemiya lengalok kiya. Lalemiya lengalok, kau orang pakai. Paxlovid, ejep cerangan ajari, only 12-year-old and up. Paxlovid. So it's more important to ajari, pag vaksin kan ejelo guna kiya ngan ajari. Elang menu Remdesivir, it's a IV injection ngan ajari rame 1 month and up. Agar yang malu pag vaksin ni, orang cuba lugun dulu.
Orang kiri itu kan kacau kiri nanti.
Jangan man.
Yaman, normal.
Kalau kami orang Cina,
Kumon. Kamu Dr. Alik melele mana good. We have a lot of donors for some of the PPEs and all this stuff coming in. Yung may kamulo le medyo may MDR kaya dengan council ruader. Iba all the council on there put merumir jangan wali kami juga air kaya de PP. Kaya land mereka hand sanitizer, soap, mitt, dan mask kami. So kamu lalu kerana rardon itu kamu lalu kerana merit buku daya dengan kaji dari mereka. Lodan konsul minan ulga, yar baik buku minan ulga yang kayak jadi kaji dari pen ala perahu dan buku ini berjalan RMI Jouj terlalu ya kerana jadi agar there's this link that we saw, for these test kits, self-test kits that you can get from and it's, what is the link?
Is the White House?
The special.usps.com.
They mail it straight to your.
And you go on the link, boom, within a week we get this test kit. I'm not saying this so that we look backwards. I mean, we're only moving forward. But some of this information, share information, I think a lot of people would have already had some of these kits with them. The sharing of information, they're critical. Sharing of information is very critical because a lot of people will already have these test kits along with these centers, TAs, MIHS.
regional translate.
Yeah. Would not be overwhelmed. I understand some of these centers were overwhelmed. They ran out of test kits.
Orang translate di tanah orang Amerika lewat peradaban lewat.
Ipituloy ng link, kaya ang link ngan ron ko yan matalan hindi na kaya elang June ni may po tayo ni online special special.usps.com kung meron nakakan ni po magaya ko ng chinunuay i-may talo ko na yun i-may makita ayaw yung respond pero wala mo yung week kung pulo na rin alam mo kung ano yung nangyari tuloy bilang pagkado yung nangyari boy monte je boy आज का इल्लू मंचर वाला का ना पिता हम जागा में people they but you know the option in the part ibi ya ke ba lang para option ka re kumiro no guru matan lo jaga e chep chep mo ga ji mo ballot in merga me chete ji pobra ji agar ibi ba joining by observation by ako balen na kachira ka German which so upon German here how do you from I can see from a political perspective but from a science perspective we extended the closing of our borders. We were targeted to open up in October 1st. Now I'm hearing we might be extending till January 13. Yeah. So from a scientific perspective, not political, your opinion on whether we should even, I don't want to get anyone in trouble. You can ignore this question and just say no comment. But science perspective. Not a question of politics, a question of science. Ginanchal ya, eu aurugin, aren kil bodor garen, tergen kertalo lo kudo bacuno. So, biar melele scientist garen, takder garen, eu aurugin, imja aurug ngan quarantine, kili bodor, ijo science itu jadi. Kalau yang betul tim garen. So, another political question. Kacitakan politics ini. Aku juga orang politik. From a medical perspective, science perspective, should we delay opening up the border? Di karbu jelake, area kabalak, potong area. Perbedaan science, itu perbedaan politik. You know what I understand, you can say no comment, bye-bye, and we go home. But if there's an answer, I'm more than curious.
I guess I can add by saying, if we were to open in October, does it make any difference if we open in January?
Well, let's just.
Ay kung balang nagandaro ang general kami, elang ngay kada lang ilo ko to pa. Euro ngay bikuno ko ta ngay kada lang ilo general. Tao ko ta. Okay.
Okay. That's a question that a lot of people have been asking, and I'm sure it'll be asked a lot in the coming week. At the moment, we have special flights, including, the Safe Travelers Program, number 8, possibly 9. When it comes to opening the borders fully, it could potentially mean you have 100 to 200 people per flight, right? At this stage of the pandemic, where we're in an accelerated or at a phase where we're still encountering a lot of cases, what we advise is perhaps an October the 1st date seems logical. By that time, we have recovered from this current wave, and after that, it wouldn't make much more sense to keep the borders open for longer periods. You just give people the requirements
To keep them closed.
Right. So that's one issue. The second is if the threats are externally significant to the country, for example, a new variant comes along that has mutated in a direction that points towards high mortality, then that situation may change that the advice to cabinet would be to consider maybe a lockdown or prolonging border closures. But at this point in time, that's what it looks like. A date in October may be good. But as I said, cabinet and Nitajala will have these debates in the coming days.
Jouj mo ko de, lula orang gua, Jouj mo ko de ng kajian.
Okay, let me try to see what I can translate.
Sama lo kajian mana?
Maybe that's what I will do, to summarize. Ilogo very scientific and kadat kam. Melele kan takatera. Ko jabo tale mugudi ke melele ko paro jagi.
Yeah. Okay.
Ay dalam takata ni ben tenere ja. Elame ko mugudi scientific perspective na ngani jugudi political perspective.
Yeah. Ngai ya gaji ngude mai bara barlewa ba tenaba ba lama nakai. Kalau lo jadi kijian ya tenaba gaji tu ne. Ema mera takda iba takda Underwood iba. Ilo koto ba ema orang aman. Karena kalau wala tak gina kijian ne. Ijalo tenaba kijian orang kijian kapelok poda rana ba ijalo. Tenaba mai ino baru tu jono bar kijian mi ukotak. Okay. Awak kijian orang kamane. Meno iba na iba, okoto ba orang man. Baginga magi kalmalaya iba, Amerika gi amjar ka belok. All wajib ijalo restriction gi. Kana gi, amjar tabar stage me all gi reba, amjar all puk jene. Okay. Jone na reba herd immunity. Bela all puk jene, ibi na mene. Jon reba ije pandemic reba endemic. Endemic and flu. Ibe repair. Ini wal around. Okay, jib John meno me. We Jouj charwali. Karmoda je ja. Ngelang COVID. Wajib berolan hospital. Retreat you outside. Ngelang John 10. Aki macam mene aje baik ya. Iberijin. Okay. Moda yo awai royan kamar pre-testing travel anton. Raja kamar lagi reba. It's here. Okay. Itu. Ejalo tak. Ini jawab jawab jawab. Ayar kaya tu kan ini. Okay, raja pre-testing ah. Kami yar, ibarat kau jawab. Raja pre-testing. Itu kan ji. Harga me rapid test. Mana me antigen test. Mana ke jawab sensitive. Mana ke also based on your timing. You got this negative. What if in 3 days I was positive? I was in the community. How do you do that? It's like, to me, it's like it's a failed policy. It's like you are infected all around and why? Kalau COVID dia orang asymptomatic, it's all symptom. Ni ada negatif orang komot. Long juluran ni orang positive. Kalau rapid test is based on your viral load. Okay, the first few days you may be negative. But as the load goes up, symptomatic, kaya ko meron pa. Kaya ko perlo community. Kaya point naman dyan. Mo naman ro, emijan menin berjin kaya. Emijan berjin. Ano naman lalgawit. Ejalo kajidak. Okay? Kaya kajilu, ilang kilan 3 ilang treatments, therapeutics, Paxlovid, managawit, vaccine. Meningin. Iba. Ejalo udah jen. Okoto bangan November. Yang punya berijin. It's like kaya jauh ilang treatment, ilang vaccine, ilang meningin. Ejalo science behind it is like I don't see the difference like between October and January. It's here, so we got to treat it. Okay, all right.
Ay second emotion am ben perlo ko to ba.
Okay.
Gimana ya? Hey, ya. provided, hey, Lugan, push the vaccine, please. Push the vaccine. Jadi memang infected aja mendukung terlalu. That's the key.
Okay.
One more.
Is it the work political perspective?
Jangan berjangan anak ini kamu lalu tak terin material penyuruh yang kamu lalu bukan kerja rewani mencarwan.
Jangan
colo tim ngantarin naik ini. Colo larang tim kan kanu harus nggak memuat.
Kerja melakok ini, baik. Kamu lalu tak Underwood, tak B. Dr. Alik, kabalaban team na health services merar take the lead ilo jarbal gain. Agay barwar chedro jangan kamolo dur. Jangan kamolo laro si Taiwan CDC. Aro si Taiwan jojen ceri menugo tu ni sinu kaya dengan mana na taran cibuki 1,000 kain gain imagine se testing kit menangani berjibang kocet jangan perayaan kamolol ADB where isn't the moment bang aja orang jaga ke macam president declaration awan akan cerita pejen cerbali tail military dan jangan approve as of yesterday coba approve what channel ADB I am done perlo account gailo finance jijino million I am jalan kamolo le di gran special kamolo Ellen in particular Ellen Milne Paul payala managar chitang cherbali pen staigan finance and put together kachitingin haring man ADB kap Leon Mehan reasoning to terrace we are pemerahan marun kononganan confirm ani bogjen ngan kecemala bar mijiran melele melele dengan kil border ai iturla turun pe mo guamlo lo line with armies without money can survive. A nation without an economy will not survive. So army ran melele ga arkili border gane kanya kaman ingat kerja slow down economy nganan marungun lale aramit financially speaking macam celok European kerja ngilo harjuta gun lain jana yang kil podor kan jana nerolok economy na macam lugu nauru army ran melele ay gujur joni yang jadi gujur kalau celok demo kuam arkil kenta celok rujar bal awal lebih positif. KNK ritus nampai narum jadi real. Apa je? Rongol cizim John reservoir land KNK, mostly cashier, frontliner runner, rarpuraino nangmits. Post office keruto postmaster narang, kay yang lukun cabai lu reservoir. Per frontline kuminan post office. Raja ibu sini negara kemencit arrangement ho kan. Majelang yan par man wiya natan. And company ka juga rar paraino di kilek kenecha problem ino. Macam army jaran melele nang imijin itu macam anu tentang apa vaccine and seek help, medical help. By many nangil meji ne jidok injogo iber ewan jago menojen melele jo isolo gunin ba ena se quarantine lo muko ber be chiba hospital nganan kajibaro resources wire amot menojen melele ge jen ka lo bodo bajen job adre meje more.
Okay. Dr. B, I think they see the new guidelines from CDC about the everything's all kind of open up, yeah. So the latest is like all the face masks and stuff. It seems like it's all, yeah, you know, kind of like it. I'm gonna give you that, but all the thing. Have you what? It's all face mask, or one. It's up to the individual. Kalau Walmart, mana face mask, macam berang. Jangan kau kan jejak. Face mask itu aku. Dia kaya tu mana malah ni face mask.
Tapi Alik ilang kay kajang closing dia, ilang kay jabrot ngani gila, ilang kay menen ko lamalagan koran pangan itu well we would need to get kawan.
Kumola Senator Kalani. General, I think the bottom line message you're gonna General pangan kajang lo Alik narang General Lalinar. Jono me urjiri General experience ikijen nangan me Lugun me General vaccine. Jalo vaccine. Minister ba. Vaccine lugun jibang. Ilo data, real data. To kumira vaccine, chiru da nangan mi churambur. Data ga renin. All of 80% kumira mich raja vaccine. Lugun lap. It's all gaji ko marong big infection. Yan flu menenga. We flu shadi. Ko marong big flu. Ako man lugun rolol. If you catch the flu. It's all the many foreign virus. Kung may vaccine na, kung mayroon bang infection niya, kung may lungon drolo, yung meron ng hospital. Yung lungon jibang. Yung naroray ba, may ilangan yung mayroon kukurean, yaman. Yan ba, ilang real data. Ilang side effects. Ito ka dito, mata pain, mata para, only a few days. Aga, yan yung jibang. Yung kengaro, mana kajang ilang nangan mit ko jino lukun rolo le menengin ibena menono itu ngani itu ngani hospital kale ilang uno kiya ngan cerma uno ngan coronavirus mere backstofet wanje pergage ko nangan mi juga wala do bena menono ben itu ilang uno Pagkurmo to kay meron yung terrible. Minungugin. Ko ba yung face mask, nagarwa mo talok, social distancing, cold beer, cepelo siya kami yung RMI, minungin olap. Yan ka mani ba, yan siya, kantini, yan ba, kishini mo yan, sila to ka dyan. Yan mga kamulol kami, kuy, Senator Kalani, Senator Muller minister kan juan forum yang man bagaya lugun mo lo kay awar ba yung information ay lugun lang disinformation out there pwedeng misinformation disinformation ay lugun lap so we need to hear the facts good informations and what you lugun jala talk to your doctor about the information ay lugun yeah they'll give it to you. Not the social media.
Not Dr. Facebook.
Not Dr. Facebook. Not the Dr. Facebook, yeah. Talk to your doctor. Right ka melele ko. What? Come on.
Kumal Dr. Alik, Dr. Brostrom, anything that you wanna
Final words?
Final words? Anything that came next?
Well, thank you again. It's an honor to speak with the group here. This pandemic is a once in 100 years global crisis. And RMI has spent 2 years to prepare for this. And now it's upon the islands. And I know the public is concerned, and the most important thing is to see the response. And what we have seen is the action of the healthcare teams, the cooperation of the government, has led to an amazing response. Being able to see the response in Saipan, then in American Samoa and in Palau, most recently in Koshrai, can tell you with confidence that that the Marshallese response is the best we have seen. The delivery of testing and delivery of treatment, especially to those who have high risk factors, is excellent. The work is not done and it's not perfect, but I think that that you get exceptionally high marks for the actions that have been taken to date. That's all I have to say this morning.
Dr. Brostrom, kalau kan nomor era perilo responsible keban, era peranan perilo responsible kalau dia ilo kucai, ilo utoro dia perilo majalin ini kali kali carwal go ilo majalin perlu pun kabar mana ni nomor ikijen respond dengan tangan begini, ini nampak tak dering ke, nai dering, dan cara balik naik ramai. Kalau ke, cek dulu perfect kan, cek dulu cukup pajen, man, ada, elang cara balik ko, lu ke ramai, elang mo, iri awam ni cara orang tu mana mana ni, man, tak mau tak terproses, man, tak terang.
Thank you, Senator. My message is to the people is for people at the highest risks, please ensure you access therapeutics. For individuals who need vaccination, also visit those test to treat sites and access it. If you test negative, you can get your vaccines. If you test positive, you'll have to wait for 2 weeks, but go back and get it. A lot of people who have had COVID are now recovering and they will start to feel stronger. We are still in it, but we are moving through it, and we'll be over this in a matter of weeks, or days to weeks. Keep in mind that the focus now shifts to the neighboring islands, and we'll move our responses to the neighboring islands to respond as the disease spreads through the rest of the country. We're also mindful of the efforts in Ibai, and we thank all the staff, health, other government ministries, NGOs, volunteers, external agencies, consultants, and donors who've come to help at this moment of need. Thank you very much.
Dr. Underwood, Kalikar, ilo camal kan nana kena ni coba, to kami lihat ni kita dah katan rajang, RMI Rome coba high risk, RMI Rome elang nangan izin tanggal nangan izin cancer nangan izin ko jod me Jouj melele lagi kuba rutoro peren rajab kata rajlo ko rajino nangan mi aragai rum dalam lolok tak deri em ngan rome rajain we jebar rajang er we ran kamani we ran puk we ko rawi pugi aga we vaccine go ngan COVID-19 kan ge ilo we kan pero iloan nangan mijin dalam cerita RMI ro ilo ailo go iligin trisyo go aga kinjar wal go RMI ro ilo chigina ro roni bar shift focus ngan ailo go iligin eme alo na oro go jab katar kone dal kiyo em we em ga chigi go jeta kai kamolul awle ben rome rar chibang ilo responsio cincinu nangar ajerin nangan miji amit kamolo lor rora palandir tagde ne mal jaman kelajar berapa naik listing tagde ne jaman kelajar ilo yang kamolo awal berinda pokona ebo kan kila ole menurun dit kamolo perjuangan ko wal ko nanin kamolo ko awal berinda ko nono iman kan pwede na doon naman kamulol Assistant Secretary ka manajawan visa benibi Charleston yang parano ministerio secretarian MOCI kana lero pagkan jangan kamane pwede na doon ilo ya yang parjolan ko balu ben awal yang kamulol chillen ngalaw kan awal puang ini riput kiri yang pangan armiin majoru armiin majo jen peru di luar kaja dari ronkjake tagin tagader ini prejepat ecep karena tagader aja rebat cep ronkjake tagader Facebook abon ronkjake lukun tagader ini kajar balik kori nembakan aja gitu ngan pengenalan orang man em parenot pagwaya ko em jab katar nganam teri em jeniye dengan yen kajong wer aga kana mes goa awalib melan awalib jogo ko jadali wajab kaja barot ko ako kaja barot brutoro ala bro mer jogo ilo moy ko jogo yi ngan jori jogo kana pa param pagene kana mes goa nganam kaja barot brutoro ni jogo ilo moy ko jogo yi no perjalanan kamolo la eleng berkamolo la mer ka konjalan mayro eleng bar pipi rej bar ana armin mayro jadi bar cibang rumah tadi ilo cujugun dari lo mayro ka ene aileng bojat ngene gitu ngene thank you everyone ya bana man pa na do kamolo la biya ko na